Thanks for taking my call and good afternoon. And
hello.
Nice speaking to you, Wes. Listen, I just need a quick question. It's about this 140 million spent on Rwanda. Could that money not have been better spent on healthcare?
Yes.
And what area of healthcare would you have spent that money on as a health secretary?
I'm going to try and be disciplined in my answering of this question and not rant at the end of the hour, right? But
we don't mind an end-of-hour rant.
Honestly, like, given how tight money is in this country at the moment, public finances, but also the money in people's pockets and people being clobbered with the highest taxes in 70 years, the least this government could do is treat taxpayers' money with respect and spend it wisely. This Rwanda scheme is a total headline-grabbing gimmick. It is not working. It is not lawful. We warned them in advance. They knew in advance. But and now Rishi Sunak is continuing with this theatre. Oh, I'm going to pass laws. Or I'm going to pull us out of the ECHR. This is just political posturing. It's slogans, not solutions. What we would do is take the money from the failed Rwanda scheme and put it into the National Crime Agency so we can smash the criminal gangs that are trafficking people across the channel. That would actually work. And on the NHS, instead of clobbering people on lower middle incomes like the Tories have done, we're going to ask non-doms who live in this country and earn their living here to pay their fair share of taxes. And that will generate enough money for us to provide 2 million more appointments in the NHS a year to cut waiting lists, 700,000 extra NHS dentistry appointments so that people can get an NHS dentist, and double the number of CT and MRI scanners. So we've not just got more machines, but cutting-edge machines so we can get more people through and diagnose more quickly. Better for them and better value for taxpayers' money.
I'd hate to raise your blood pressure even further than it already is after that.
I've only got one kidney. I've already been told to keep an eye on my blood pressure.
I've only got one kidney. I'm sure it's a marvellous functioning kidney.
It better be. It's the only one I've got now.
Yeah. You can have mine if you need. You can have one of mine if you need it. The new Home Secretary, James Cleverly, on the radio this morning said that Labour's policy on stopping the boats, as they call it, is bits of what they're already doing and less than.
Oh, James. I'm so disappointed with James Not So Cleverly today, because he did not deny, did he, this morning, and excuse my language, listeners, but he did not deny that he had called the Rwanda policy batshit when he was Foreign Secretary. But he's going through this silly pantomime as well of pretending that there is a different approach. And look at what the public are telling us. Of course, people are anxious about the boats and want to stop the boats. So we've got to reach for real solutions. They're sick of broken promises and gimmicks, and that's what Labour's come up with. We've come up with a plan that might not be as headline grabbing and gimmicky, but I know this is controversial in today's politics. It might be a plan that just actually works. Wouldn't it be nice to have some political decisions that improve things and make things better? I know this is a revolutionary concept for people listening who are just used to politics making their lives more expensive, harder, and seeing their public services weaker. But, I mean, that's why we desperately need a change in this country. A general election can't come soon enough. And I hope that you will give change a chance. And give us a chance to try and put right so many things that have gone wrong after 13 years of Conservative government.
Wes Streeting, thank you. Shadow Health Secretary for taking people's calls. Labour MP for Ilford North.